Morning, everybody. Today we're going to talk about our approach to headache station. What are the important things you need to do always in every headache station? When it comes to headache, to be honest, the differentials are actually quite big. And as you're aware, you have 8 minutes to demonstrate your competencies, of which those 8 minutes you should be using maximum 5 minutes of them to take your history and 3 minutes for your management. So, what are the questions to ask? For every headache scenario, you need to ask your Socrates. So, for every headache scenario, make sure you finish the whole Socrates. At this point, I believe everybody knows what a Socrates is. So I would link my other video where you can look at all the criteria for Socrates. But make sure, because in that Socrates lies the answer that you're looking for. It could be the onset, the character, whether the pain radiates, the severity. Your answers are there. So do not forget to explore the entire Socrates. Now, after exploring Socrates, the next question you need to ask is anything else? Do not ever forget the power of anything else. This is really, really important. After that, what are the red flags? Now, when it comes to headache, personally, I think that there are 3 or 4 main red flags we need to care about. One is trauma. Did you have any fall? You want to find out, and if there is a fall, then of course we will explore that. But I would prefer to talk about falls in the videos related to falls. Now, another question, red flag, is meningitis, because you definitely do not want a patient who has a headache that is meningitis to walk away from you. That would show that you're a very unsafe doctor. And now, what are the symptoms of meningitis? Stiff neck, photophobia. So these are things you're looking for, a rash. And how do you ask those questions? Any sensitivity to light. So you don't go to your exam asking the patient, do you have photophobia? I know these things might seem simple, but you will be surprised. Any sensitivity to light, any neck pain or neck stiffness. So these are the things you should look out for, and any rash. And you should ask that for your headache stations. Now, the other one that is very important is strokes, maybe. So just ask, any weakness and numbness in any part of your body, because it could be an hemorrhagic stroke. Or you could even ask, and that's why you have to do the Socrates, because at the point of your S, the severity, the patient would have told you that that is the worst headache of their life. These are your red flags, essentially. So look for trauma, look for meningitis, look for your subarachnoid hemorrhage and your stroke. Now, the next part of your history, which is not complete yet, is your P2 maftosa. What is that? Has this ever happened before? Previous episodes, you should never forget that. Past medical history. Is there any medical condition you're managed for? Or have you had this type of headache in the past? And if the patient has had this headache in the past, what do? You explore it. And how do you explore it? Ask them. What has been done for it? Was there anything that you were given in the past? So this is very important. Then the other part that you're supposed to explore is any allergies. You have to ask allergies. And when you get the history of allergies, it's not enough to just say, you have to ask what type of reaction. And you can even go further by saying that you would ensure that this is documented in their notes. This is very important. It makes you safe. You have to do those. You ask them any medications, because think of it, there is also analgesic induced headaches. This is very relevant. These are important things. Are there any medications you use that includes over the counter or supplements? Do not forget that. Don't just say, are you on any medications? For example, if your patient has migraines, a female patient, ask about the use of contraceptives, because as a doctor, one of your goals on that day will be, if the patient has migraines and the patient is on contraceptives, well, you need to review that medication. It needs to probably be stopped. So these are things that you're going to be looking for. Family history, you must never forget. Why? Because sometimes there lies in your answer. Patient might tell you the mom has migraines as well. And if the history is already consistent with migraines, then you know that with your full chest, you can definitely say, oh, I think you have migraines. These are really important things that you should definitely be looking out for. And please, my emphasis here, this is me. You have to ask about lifestyle. Do they drink? Because sometimes your patient might have an hangover headache. It could be a headache due to drinking. It's important, lifestyle. But I mean, from your Socrates, you will know what your issues are already. From your initial data gathering, you will be familiar, or you will know what exactly you're looking out for. But ask, drinking, smoking, because also if a patient has tension headache, they might tend to drink more, hoping that it will reduce their stress. They might tend to smoke more. So you cannot forget those two at least. Maybe exercise and diet. But I mean, if you have the few seconds, you can ask. But definitely do not forget history of smoking and alcohol. Because even for your subarachnoid hemorrhage, this can be a major risk factor. So these are key important things that you should be asking. And finally, my dear doctors, your history taking is not complete without psychosocial and ICE. I will keep saying this every time we practice, every time we talk, because this is very important to me. History taking is not complete without your psychosocial and your ICE, because you're not just treating a disease, you're treating a person. And this is one of the things that they want you to look out for in a clinical scenario. Not just treating a disease, you are treating a person. You need to ask, how has this impacted you? How has this affected you? It's important. Don't forget that. Make sure you look for your psychosocial and your ICE. I've already talked about ICE multiple times. Ask the patient, what is their thoughts about this? What is going on? And ask about what their biggest worry is. You might think that this patient's biggest worry is about the headache, but the patient's biggest worry might be something that is related to their job. Please make sure you ask the patient what their concerns are. All right, doctors, that is it in your general overview for history taking. Just to add a bonus is your physical examinations. Do not forget to do your general physical examination. Do not forget to examine the nerves of the head and neck. And for almost every headache station, please remember to look at the back of the eye. Just say it. Yes, sometimes you might really have to do it, and sometimes it's just enough to verbalize it. But do not forget, because if you think about it, if your patient has intracranial hypertension, there is going to be papilledema. If your patient has a subarachnoid hemorrhage, you need to look at the back of the eye. This is important. Whatever the history is, please do a fundoscopy. And please stop saying head to toe, and pick up a general physical examination. All right, doctors. In another video, I will talk specifically about each station, each headache station, and the management for them. All the best, doctors. And of course, if you get value from this video, please, it's really important because it does encourage me to make more videos. Please do give it a thumbs up, do like it, and do share. And I wish you guys all the best on your professional medical examinations. Bye, doctors.